Hello there, folks. Welcome, my epilepsy warriors and seizure disorder people. Gold purple, right? Welcome to my channel, My Brain Wreck. So last week, or a few days ago, I talked about the vagus nerve stimulation, what that does for you, and what people do, what it's used for in epilepsy and things like that. So this time, we're going to talk about the RNS, responsive neurostimulation stimulation. So basically, it's a implantable device used to treat epilepsy, particularly those that are drug-resistant focal seizures. It continuously monitors brain activity, and upon detecting abnormal patterns in the brain, of course, delivers an electrical pulse, kind of like a pacemaker, basically, just like the VNS, to the brain to potentially stop or reduce the severity of seizures. RNS is similar to a pacemaker for their heart, but it monitors and responds to brain activity. So when your brain is all messed up or whatever, or recognize something that's not working right, sends an electrical pulse to your brain. So how does it work? Well, the RNS is surgically planted into your skull, basically, with electrodes placed either on the brain's surface or within the brain's tissue. So I want to say it's usually on the left side mostly for most people. So it's like right up in here because of the focal whatever. And people that have drug resistance to the anti-seizure medicine stuff. So the symptoms can be like right inside or deeper, I believe. Not for sure though. And just for a disclaimer, I'm not a medical professional. This is just for information purposes only. I'm just passing this on, all right? For all those that are wondering and stuff. And I try to do my best in layman's terms, I guess you could say. Basically just gives you a shock to your brain to make sure that it's working there properly the best it can. And now I'm not saying guarantee is always going to work, but it's how it's supposed to work. So how's the monitoring done? Well, the device constantly monitors brain activity, looking for specific patterns that indicate a seizure is about to begin. So if I'm not mistaken, there's I'm not sure if you have a machine that comes with it or not. Don't take my word for it. Like I said, I'm not a medical profession, so just like I said, I have underneath my heart here is a loop recorder, which is like a constant EKG, just make sure my heart's doing the right thing and stuff. Because they did see something on there. I'm not sure what they said, but a normal pattern or something. So, and I do have a secondary heart block too. So, which means my Patriot, I can't remember, whatever it is, and also polycythemia, where I have too much red blood cells and so forth, or whatever. So basically, the response is the device constantly monitors brain activity, obviously, looking for specific patterns that indicate a seizure is about to begin. So when it looks for, it recognizes something in the head here, it just sends a pulse of some type through your head. And I guess it takes time to get adjusted to when you first get one, because I guess they say you do feel something maybe at first or whatever, but then you just get used to it. And sometimes they might have to go back to the hospital or where and get it have it readjusted to where it's getting the right shock, I guess you could say. So basically, when the normal patterns are detected, the RNS device delivers a brief electrical pulse to the brain, like a pacemaker, like I said, either stopping the seizure or reducing its intensity and duration. So it's supposed to help lessen it and not making it so as powerful, and making it strong. Now, the people that are who are candidates for this space for the RNS, it's usually people who are drug resistant focal epilepsy. Individuals with focal seizures that haven't been controlled by medication are often considered, usually. Means basically the medication hasn't done nothing for them or anything like that at all. So, and from our readings and stuff, it does help quite a few people and stuff. It has lessened their seizures, so quite a bit for a lot of people. I'm not sure how many, but quite a bit. So basically, inability to undergo resective surgery. So RNS may be an option for those who are not suitable for traditional epilepsy surgery, where they basically take out something in your brain like that. Like maybe they recognize something up in your brain here that's not part of your brain is not working the right way. There's something there that could be there, or something really small on your brain there they see and be causing the seizures, and they take that part out. But if they're not a candidate for that for resective surgery, then they next thing is to think about the RNS, for that. So it may help them. It's hard to say. So basically, as I said, it's a responsive neural stimulation. Maybe it's called multi-seizure foci, FOCI. It's basically, it can be used for individual with multiple seizure origins in the brain. So you got seizure here, seizure in the front. Your brain is one of the most complex things in the world. It's actually the most complicated computer in the world, believe it or not. They say we only use 10% of our brains, I believe. Imagine if we used all our brain and stuff, what we could think about and how the world would change. There's some people that use more than 10% of their brains, but it's the way how we have to tap into it. Some of us don't know how to tap into it, but that's okay. This is how we are. We're all human, right? So the advantage of the stimulator, the RNS, your responsive neural stimulator. It's less risky than the resective surgery, obviously, because they're cutting open to you. So it's a less invasive procedure compared to removing or damaging brain tissue. Because if they do cut your brain, there's going to be damage, obviously, because they're cutting into your skull. They're drilling in there, basically, I guess you could say. It's reversible. So the device can be removed at any time if necessary. And I don't know how many people had that device taken out or not. I'm not sure. I haven't gone that far into it or seen. So, as for the continuous monitoring, the responsive neurostimulator provides valuable data about brain activity, which can help doctors optimize treatment. So, as the responding neurostimulator, for the effectiveness, studies have shown that the responding neurostimulator can significantly reduce the frequency of seizures, with some patients experiencing a 75% reduction, that's great. That's pretty good. It's not bad at all, actually. So, a reduction of more after 9 years of treatment. That's according to the National Institutes of Health. All right. Like I said, this is for information purposes only. I'm just letting you know that's all this is for. Like I said, I think I told you guys in the last video, I finally got diagnosed with epilepsy. Finally. Officially. Clinically diagnosed or whatever, so. Eventually, I've been doing a 48-hour ambulatory EEG here. And I might just come online and post it and whatever and talk about it, actually, while I'm wearing the little electrode and stuff. But of course, I don't know how I'm going to be able to do that, and I'm not sure. Well, actually, I think I'm not going to be able to, because I'm going to have to be watched around everywhere and try to stick to the bedroom mostly. But anyways, it can responding neurostimulation can also lead to improvement in quality of life and cognitive function, obviously. So I'm going to read an article here, actually. This is from Geller EB Epilepsy Behavior, 2018. Responsive Neurostimulation Review of Clinical Trials and Insights into Focal Epilepsy. So, this is from pubmed.ncbi.nih.gov. This is from 2013, I believe. So the responsive neurostimulator has been available clinically since 2013. So it's been available for about 12 years now for treatment of medically refractory partial epilepsy using intracranial electrodes in a cranial implanted device. This is RNS provides on-demand electrical cortical stimulation to reduce seizures. So cortical, if I'm doing this right, please excuse me. Cortical, I think that's what that means, anyways. A randomized multi-center double-blind clinical trial demonstrated seizure reduction compared with sham stimulation. Seizure reduction was improved and sustained over years in a long-term treatment trial. It says the RNS provides chronic ambulatory electrographic monitoring over years, giving unprecedented insight into epilepsy dynamics. Studies to date have looked at the length of time to detecting bilateral seizure, so both sides, onsets in mesial-temporal lobe epilepsy (MTLE), demonstrated biorhythms in interrectal there we go, epileptic form activity over varied time scales, and shown promise in early detection of benefits of adding a new anti-epileptic drug. Question remains as to the boundaries of patient selection and lead placement. This article is part of the supplement issue Neurostimulation for Epilepsy. All right. And this was copyrighted from 2018. So if you want to look up cortical stimulation, epilepsy surgery, tractable epilepsy, and responsive neurostimulation, those are the keywords that they're looking for. Other than that, basically, so that's what that does. So there's two options out there for different things: the vagus nerve stimulation, and then the responsive neurostimulation. And each one does different things. As I said, the responsive neurostimulation is for people that their medicine's not controlling or anything for their seizures. Their medicines, anti-convulsants, anti-seizure meds, or so forth. Just not doing nothing. So that's an option for you guys to think about and look at. Now, like I said, it's an implantation that goes into the brain. It's surgically implanted into the skull with electrodes placed either on the brain's surface or within the brain's tissue. So basically, shave your head off. I had to shave your head off, man. They shave and stuff right there and put stuff right there. Like just put like a little right there on the outside there. And just surgically put it right there. They open up your skull, your brain a little bit, and they implant it in there. Just letting you know. So that's one way of looking at that. What else is there? There's different ways. So like I said, with the response, when abnormal patterns are detected, the RNS device delivers a brief electrical pulse to the brain, either stopping the seizure or reducing its intensity and duration. Now, as far as stopping the seizure and stuff, and I'm not sure if they require you to, if they have a rescue inhaler, like what do you call it, Nizium, I can't pronounce it because I have some myself. It supposedly helps stop the seizure. You just spray up your nose onto whatever. It's supposed to stop seizure right away after, I think it was supposed to do after a minute or whatever, or two, I can't remember. So that was done to me once, but then I think that my wife did that to me, and I think it made me go unconscious. Well, I was already unconscious. I didn't know what I was doing. So, but yeah, it's scary. It's a scary thing to think about, but also could be a life-saving thing for you. So just think about the RNS, responsive neurostimulation. There's different things they do. So now I'm just going to read some more again here about how it works. How does it work? Basically, how does the RNS work? So the RNS is a closed loop system that continuously monitors the brain's electrical activity and sends a brief pulse of electrical stimulation directly to the brain when a seizure or seizure-like activity is detected. So doctors specialized trained in RNS program the neurostimulator and gradually train it to detect specific patterns unique to a patient's seizure. Now, how effective is the RNS? Which I just mentioned. This is a different article, I believe, or a different thing. In clinical trials, more than half of the patients treated with RNS have 50% or fewer seizures compared to their pre-surgical baseline. The median decrease in seizure frequency with treatments was 60%, 67% at 1 year, 75% at 2 years, and 82% or more in years 3 through 6. So not too bad. It's pretty good. Now it says here, perhaps the more importantly, most patients report a significant improvement in their quality of life with RNS. So they got more independence and stuff, able to do more stuff probably, and able to do things on their own, knowing that they have something there that could help them reduce their seizures and make them do extra activity or something that they haven't been able to do in a long time. That's what I'm guessing, anyways. But it's also important to keep in mind that the seizure reduction from RNS is not immediate. All right, so it's not going to just happen like that. It may take several months to notice an improvement, and it will likely take years to achieve the optimal results. So, like I read in some other things, so 3 to 6 years. One of the articles are 9 years. But is it worth it? That's up to you guys. I think maybe in the long run it's worth it. If you feel something happening a little bit, just even a little bit, you feel different or something that's actually working. That's great. Now I know you guys are asking, well, what is the surgery like? So basically, the surgery to implant the RNS system is performed under general anesthesia and typically takes between 2 to 4 hours. So many patients are able to go home the next day. So you're going to stay in the hospital because they're going to monitor it, make sure you're okay, nothing's going wrong. Others can expect a 1 to 3 day hospital stay sometimes. It says no bed rest is required after surgery, and many patients are able to return to their daily activities within a few days and even return to work in 2 to 4 weeks. So for those that work and stuff or cannot work or whatever, or do work, you can return within work to 2 to 4 weeks. I mean, think of it as like a vacation and stuff, but yeah, you're losing out of money probably, but maybe you have some PTO built up or something like that, but it's hard for people, people that have epilepsy and they just don't understand it. Not yourself, but others are uneducated and just think that don't know, we're just acting weird or whatever. May look weird to them, yeah, when we have our seizure and stuff, but we have no control over that, right, guys? Right, Purple Warriors? So we gotta be strong and just chip out a little bit, lay a little bit. I know some of you guys probably think, nah, I'm not worth it. I'm just gonna stay here, do this and do that. Don't let other people dictate how you do things. Be yourself and stay strong. Chip away at it just a little bit by little bit. No matter how small thing you accomplished, even just by accomplishing the smallest thing is an accomplishment. Even just going from, let's say, going outside to check the mail or whatever. If you have to walk outside to check the mail, like me, I gotta walk outside and cross the road to check my mail. Well, I live in the country, so that's where I'm at. So basically, that's what the surgery is like. So what are your responsibilities with RNS? Well, what the yeah, sterile. I can't even pronounce the word now. Neurostimulation. All right, guys, I'm back. Sorry about that. Just had to take a little break there real quick. So, what are the patient responsibilities with the RNS? So, responsive neurostimulation. So, basically, people who choose the treatment with the RNS system play a key role in their own care. Obviously, you want to care your own care. So each patient is given a remote monitor. Okay, so I thought so. They're given a remote monitor, which is essentially a laptop computer. Which I did not know that. So there you go. What's a laptop computer? Interesting. So you probably can see all kinds of stuff on there. To which they must download the information stored on their neurostimulator on a daily basis. So keep that in mind, folks. That if you're going to get that treatment, that you're going to download on a daily basis, and so you might want to set a schedule when you're supposed to download and stuff. And I'm guessing this is for your doctor to see how you're responding to it and stuff, and if they need to adjust something on there or redo something, which is, like I said, what it says on here, which is essentially a laptop computer to which they must download the information stored on their neurostimulator on a daily basis. So the process just takes a few minutes a day. So once a week, they are asked to upload the data stored on the remote monitor to a secure website database where their doctors can review it. Well, let's hope it's secure and stuff because all this data breach that's gone through. It's like my wife herself, she's gotten her stuff from 2 different places, her medical stuff data breached twice from 2 different places. Go figure. So just be careful about that, what information you're putting out there, all right, guys? So patients are given a magnet and are asked to swipe the magnet over their neurostimulator. So just a magnet, just like, and I believe the VNS has one also. So Patients are given a magnet and are asked to swipe the magnet over their neurostimulator when they have a seizure. So when they have a seizure, so I'm not sure if it's after a seizure or before. I'm not sure. I'm sure the neurologist will talk to you about it. This action marks a particular event as important, and the device stores the brain activity recorded during that time so the doctor can take a closer look at it. It's also very helpful for patients to keep a detailed journal noting when they have a seizure. So if you have somebody that lives with you or whatever, and you know that you had a seizure or whatever. Now, like I said, I don't know if you do it after you had the seizure. I'm guessing that's what it is because it'd be kind of hard to do if you're having a seizure. I'm assuming unless you are aware of what's going on in focal seizures or something like that. I don't know. Obviously, this seems like for a lot of focal seizures. I'm not for sure, not for positive how it exactly works because, like I said, I'm not a medical professional. I'm just passing on information with you, for myself too. Like I said, that's why I call my channel My Brain Wreck. So, and by the way, here my words come out funny or differently, is because I cannot form in the right way sometimes. Like I call them word salad. I know what I want to say, but it just doesn't come out the right way. So the action marks that particular event as important, and the device stores the brain activity recorded during that time so the doctor can take a closer look at it. And then, like it says on here, it's also very helpful for patients to keep a detailed journal knowing that when they have a seizure. It's extremely important that the patient be willing and able to attend the following up appointment so the device can be programmed as needed to achieve their best results. Typically, follow-up appointments are scheduled every 4 weeks throughout the first year, but eventually become less frequent. I'm going to show this on here so you guys can see.
35% of these patients are actually not responding to medications. Their quality of life is affected, they have side effects from medications, and they are at risk of injury anytime they have a seizure and even dying.
I was diagnosed in 2001. The doctors feel, though, that I've most likely had epilepsy through at least adolescence, if not sooner. I haven't been able to drive for 13 years, which has been hard. But also, when my friends, my coworkers, started noticing things, I had to stop work.
Till a few years ago, seizures used to be treated with either chemicals or surgery or diet or electrical devices that were implanted in the shoulders and then sending electrical impulses to the nerves in the neck. But RNS is implanted in the skull and it detects the onset of a seizure directly from the brain and then sends in a tiny electrical impulse to stop the seizure just at the beginning.
This is an implanted brain stimulation device that was approved by the FDA about 1 year ago. And we've successfully implanted patients now here over the last several months.
We can teach this little device how to properly detect the seizure signature.
It feels when a seizure is coming on, and then the device will zap it.
The surgery to implant the RNS system is fairly straightforward because we already have all the information we need. So this is standard stereotactic procedure. This is the recording and stimulating electrode. It has 4 contacts. It's going to rest on the brain surface. This is the small computer. That's the neurostimulator. It fits in your hand.
You can see on this X-ray of the skull the battery implanted right here, the little device. And there are 2 deep electrodes, one that is going on the left side and one that's going into the right side, targeting the areas that started the seizures. Every single day, what she does, she will use the wand and download the data from the device into the computer. Approximately once a week, she will hook up the computer to the internet, and all this data will be transferred into what we call the patient management database. The device does not work right away. There is a lot of work involved from the physician to teach the little device how to deliver and what to deliver stimulation on. So far, we implanted 4 patients with the RNS device. We were not expecting improvements so fast, but our first patient, Georgette, was implanted in January, has already seen a significant decrease in her seizures. You can see the seizure starts to spread in the left-sided channels, and the seizure will be ongoing and not stopping, though we are done with 90 seconds of what we were able to store in our device. We adjusted the parameters and reprogrammed the device to deliver the stimulation much faster and to be able to detect much better the seizure signature. And you can see the seizure building up on the left-sided channels, left side of the brain, and we were able to stop the seizure very early.
So I think even a small decrease in seizures would improve the quality of life a lot.
The doctor said I may be able to work again, which will be a good thing, because I miss working. I miss my coworkers, I miss interacting with people. So that would be a real plus.
So you guys can see there what it does and how it works. It gives you an idea what you can expect if you get that type of a device into you. So I hope this information has been helpful to you guys. This is my brain wreck, of course. So for those that have maybe had to go with that type of stuff, I hope it will help you if you plan on doing that. So that's just an idea of what it does, And I'll write down where I got this from and so forth. It's scary. So then I think I already said who should get the RNS. The RNS system is to treat adult patients with focal epilepsy who have failed treatment with at least 2 seizure medications. Our approach is always first. Their approach is always first to determine with patients are candidates for resection of their seizure focus, the only potential cure for epilepsy. So patients are considered a candidate for RNS when they have undergone comprehensive diagnostic testing that has localized 1 or 2 seizures of foci. FOCI. Please forgive me, I'm not sure what that word stands for, or FOCI, but are determined not to be candidates for surgical resection for a particular reason. These reasons include seizures that originate from more than one area of the brain, seizures that arise from areas of the brain that cannot be safely resected, or seizures that are difficult to discretely localize. All right. So you guys, like I said, I just repeated that, and I'll put that in that, and I'll try to get the video in there too if I can find it again, wherever it came from. I think it's way down here somewhere. Is it down here? So this is from the University of Pittsburgh. This is where it's from. Well, guys, thank you for watching my brain wreck. I hope you guys got something out of that, and that you're able to see that video on there. Hopefully it comes through on here eventually. I gotta learn how to cut and add a video from somebody else's in there somehow eventually. So thank you for watching my brain wreck. I hope this gives you an idea what you can expect from an RNS and responsive neurostimulation surgery. So you guys have a great day. This is my brain wreck.